Today we're with Joceylyn Montgomery from the California Association of Health Facilities, and we're going to discuss the emerging infectious disease situation. Joceylyn?
Hi, thanks, Joanne. Basically, I'm a nurse that's been involved in disaster preparedness and pandemic flu preparedness for about a decade. And last year when the Ebola outbreak happened in West Africa, but because we received patients in 3 medical centers in the United States, and then we had that unfortunate case in Dallas, there was a lot of fear and concern among the nursing home community about how they should be ready for a new, novel, dangerous disease like Ebola. Well, in reality, Ebola was a very small threat to nursing homes, really rare disease, and not particularly one that we had to do a lot of preparedness for, but it really spurred the idea among several of us at AHCA's Emergency Preparedness Committee that there could be a new infectious organism any day, something like SARS, something like avian influenza, and very much like the H1N1 or swine flu outbreak in 2001 that could change our reality from one day to the next. For instance, during the H1N1 outbreak in 2009, nursing homes in California were told, you need to keep people in your facility even though they have that confirmed diagnosis, because we're expecting a hugely overcrowded situation in our hospitals. So unless they need acute care, they need to stay with you. You don't get to transfer them out for the isolation alone. And that meant nursing homes were expected all of a sudden to have respiratory protection programs for their staff, and a new level, kind of the bar was raised on infection prevention. So to make a long story short, for the last year, the American Healthcare Association Emergency Preparedness Committee has worked on a guideline that will help nursing homes look at what they need to do to generally be ready, what they need to do to ramp it up to like the yellow level of alert if there is an identified organism that poses a threat to their community, and then what to do if there's actually a suspected or known case in their facility of a dangerous emerging infectious disease. And it's not as onerous as many nursing home providers might think. So I encourage them to get a hold of our guidelines and be ready for whatever could come along.
Thank you, Joceylyn, very much.